Now is the time to answer some of your common health questions. As always, News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center, is here. Let's start with this one right here. A viewer question: are women more likely to develop gallstones than men?
Yeah, you know what? They really are. Actually, significantly more. 25% of all women will develop gallstones by age 60 and 50% by 75, as opposed to only 25% of men. So we really think it's because of estrogen. Estrogen is known to increase the cholesterol, or at least the conversion of cholesterol in the liver to bile, which then, of course, can accumulate and create gallstones. There's two additional reasons that are specific to women. Number one, pregnancy. We see gallstones commonly in pregnancy. You know, the estrogen buildup, the bile formation, and so forth. Also, hormone replacement therapy in elderly women for osteoporosis and the like, also with the estrogen, the exogenous estrogen that they're being given, can also increase triglycerides, which can then in turn form more bile. So if you're a woman, middle-aged or greater, and you're developing pain here underneath the rib, probably not indigestion, make sure you get it checked out, because most likely, not even somewhat, but most likely it's going to be gallstones.
Wow.
So
okay, two words right now: high blood pressure. So many people out there are familiar with that. Can you go over the symptoms for us?
Sure. And that's actually one of the biggest misperceptions, and that is that if you're not having symptoms, I must be fine, I must not have high blood pressure. And the reality is that hypertension or high blood pressure is a symptomless disease. You will not have symptoms unless it's real high. And typically, upwards of high normal is a systolic of 140. You're not going to develop symptoms until your systolic is 180 or greater. And those symptoms at that point will be, when your blood pressure is dangerously high, will be headache, chest pain, shortness of breath, dizziness, things like that. But when you are within normal high, you will absolutely, for the most part, not have any symptoms. And what can happen untreated for longer term, develop heart disease, kidney failure, stroke, things that can long-term affect the heart.
Regularly.
So always go to your doctor. Make sure you get it checked regularly. And if you can't, just go to a local drugstore or a local supermarket and get it checked out. Very important. It can save your life.
All right. Thanks, Dr. Soria. If you have a question for the doctor, you can send it in by going to our website, WPTV.com. Click on Health Link. You'll scroll down on the right-hand side. You'll see that form to fill out your question.